we are discussing weight loss medications. I'm sure you've heard of a few: Ozempic, Wegovy, Mounjaro, Zepbound. These are medications that fall into the class of meds known as GLP-1s, so glucagon-like peptide agonists. Could these meds be the new wonder drugs? Well, we're going to discuss that today. Now, I have to say that in my almost 20 years of practicing medicine, I have never really been fond of weight loss medications. In fact, I typically did not prescribe weight loss medications. However, with the availability of these medications and the constant data that is showing benefit, not just in weight and blood sugar control, but also in heart disease prevention and other chronic conditions, working as a preventative measure, not just a treatment measure, I have changed my thinking and approach. Now let's talk about some of the other potential benefits of GLP-1 medications, how these could perhaps be the wonder drugs. First, dealing with cardiovascular disease. Now, there's much promise that has been shown so far with GLP-1s and cardiovascular disease. The SELECT trial found semaglutide consistently reduced major adverse cardiovascular events by about 20% among patients with prior cardiovascular disease and who were overweight and obese. It is thought that the GLP-1 mechanisms have a direct impact on blood vessels, improving blood pressure, and lipid profiles. And I can say anecdotally that for my patients that I've started on GLP-1 meds, cholesterol levels have improved after being on the medications for several months. Now, disordered eating and addictive behaviors, another area showing promise, which I have also noticed in my practice are the effects of GLP-1s on disordered eating, particularly with binge eating disorder. So, in a number of my patients, I've started on a GLP-1 for weight management who happen to have binge eating disorder concurrently. It did dramatically impact the frequency of their binge eating episodes to the point where I've been able to, in some cases, stop meds that were previously prescribed for binge eating disorder and continue the patient solely on a GLP-1, essentially killing two birds with one stone, aiding with weight loss as well as abnormal eating behaviors, essentially working to drive down the food cravings. And as some would describe, the food noise that was no longer prevalent. They were no longer obsessing over food or feeling controlled by food while on this medicine. Fertility is another area of promise for GLP-1 use. Now, understand, GLP-1s, such as semaglutide, are not intended to be a fertility drug, but the weight loss achieved with these medicines could improve fertility. So, weight loss for those who are overweight or obese can dramatically improve fertility outcomes for those looking to conceive, whether you do it through diet and exercise alone or with the use of meds. It is thought that semaglutide, however, in addition to aiding with weight loss, may improve menstrual regularity and ovarian function